Hi everybody, my name's Penny Hunsiker, Senior Health Coach with American Health and Wellness Group, and I'm here today to help you cope with COVID-19, especially if you are an essential worker, but we also have tips for those of us that are working at home as well. So please remember that the CDC has said the way we contract and pass this disease is by airborne, primarily airborne particles called aerosols that are being transmitted from person to person. The second way we are infected is through contaminated surfaces where the virus has landed on hard surfaces and then we touch our mouth, our nose, or our eyes. So if you are an essential worker or working at home, the number one thing is always clean your workspaces, especially those that you are frequently touching. If you are working outside of the home in an office or with other people, you want to make sure that the time clocks, the handles, doorknobs and things like that are always disinfected. If there is a telephone that many people are using, you want to make sure that you designate one person to use that telephone and not several different people. Now, how do we protect ourselves outside as essential workers when this virus can be airborne? Well, one is social distancing. Remember that the CDC recommended 6 feet apart will help us prevent from passing those that virus back and forth. This protects us from getting it in our mouth, into our nose, or into our eyes, which someone can easily transmit simply by speaking, sneezing, or coughing. So social distancing is number one to protect us against the airborne. Also, if you are at work and you have to work with a coworker, you don't want to spend concentrated times in the presence of anyone, except of course those people that you live with. So if you have to communicate with a coworker, make it a very brief conversation and try to stay as far apart as possible. If you are interacting with the public or a coworker, the next thing you might want to consider, as we have all been instructed by the CDC if we leave the house, is to wear a mask. Now, the CDC actually has a wonderful website showing the Surgeon General how to make a cloth mask out of something as simple as a bandana or a t-shirt. This cloth mask I made out of a bandana simply has 2 ponytail holders on it or rubber bands to secure around your ears and would protect you. Now, the nice thing about this is I can bring it home, I can throw it in the washer and reuse it. Another type of mask we're not necessarily supposed to be wearing, but I have to address it because I've been out in public on essential errands and seen people wearing these. So you might even be wearing these at work, especially if you have to interact with other coworkers. It's highly recommended by the CDC that we prevent the spread of this by wearing these. Now, the Department of Health and Human Resources have said we don't have a lot of evidence that a cloth mask would protect us from acquiring the virus, but the science strongly suggests it's going to prevent us from spreading the virus, which this is like a social responsibility to do. So I have a relative, my daughter, that is a nurse, that is an essential worker, and it gave me a great sense of peace to know that as soon as she shows up on the job, she has to wear a mask. Haley, would you be so willing to use your professional expertise and tell us about how to properly put on and take off a mask? I've often heard people using these improperly and not for what they were intended for. So the precautions I'm about to show you with Haley, who is an RN, are the same even if you're wearing a cloth mask, but just for convenience, we're going to use this mask for now. So Haley, tell us, how were you trained on the proper way to put on and take off a mask?
So the proper way to put on a surgical mask is to take the elastic strings, put them around your ears, and pinch the wire over the bridge of your nose to secure it and pull under your chin.
So now by wearing this out, and even if it's with your coworkers or a grocery store, this now becomes contaminated on the outside and inside. So you still want to keep your hands away from touching the mask. And this is what the CDC has said. They're worried people get a false sense of security wearing a mask. So you want to be careful. So it's now contaminated, so when you remove it, what's the proper way to remove a face mask?
So the proper way to remove a face mask is to first and foremost, if you're out and about doing your essential errands, do not pull the mask down under your chin because it has been contaminated and therefore it is open with germs and bacteria and you're contaminating the rest of your body. So once you have the mask up over your nose, you want to take the elastic bands, pull them out straight from your face, and then just drop the mask in the trash can. This is only a one-time use mask.
So you do not reuse these. This is one thing I've heard from people. They'll get a hold of one of these masks, someone will bring them home and they keep them in their car, or they'll keep them at work at their workstation. This mask, after one use, is now contaminated and needs to be thrown out. Haley, I've also heard and seen people using gloves throughout the day. I've seen them in the grocery store and I've seen them on delivery drivers. What is hospital protocol about these gloves?
When we wear these gloves, we use them for one certain thing only, whether it has to do with a patient. We use them that one time with that patient and we throw them away. We do not keep our gloves on and go to another patient's room. That way we would be cross-contaminating. So it goes the same for essential errands and doing essential things or delivering packages. It's one time. You touch one thing, you throw them away. That's it. You don't reuse them because you will have cross-contamination.
Thank you, Haley. As you can imagine, Haley, she does live with me. So one thing that gave me a great sense of peace from her maybe even being a carrier is that as soon as she shows up to work, she does have to interact in close quarters at times with coworkers, so they wear a mask the entire time. So I would think that that's good for any of us that are essential workers working with our coworkers and our public. In addition to that, we should be taking, if we're working outside of the home, we should be taking off our clothes. Another relative of mine is a UPS delivery driver, and another one is even one of my colleagues has a first responder who is a husband, and they immediately take off all of their clothing before they come into the house when they're wearing it at work. When you do that, it's very important. It must be taken straight to the washer and put in the washer, not put in a hamper. You then need to go wash your hands immediately. Some people are putting their clothes in and going up and taking a shower. You need to put your clothes in the washer first. Secondly, wash your hands, then go take a shower. Also remember the night, please disinfect your anything that you reuse, like a lunchbox or a water bottle, and use your disinfectant wipes to get it ready for the next day. It might be a good idea during this time to use anything you can that's disposable. So I hope that was helpful for you. It gives me peace of mind to know that those in my house that are essential workers are protecting themselves and others. And look forward to more videos on how to cope with COVID-19.